Welcome to Module 3 of the Cancer Toolkit. Please make sure you have completed all previous modules before starting this section. Module 3, Breast Cancer Awareness. The aims of this module are to increase awareness of what breast cancer is, understand how it is diagnosed and treated, learn about the possible signs and symptoms and the screening services that are available, learn about screening uptake in Leeds and how we can encourage more people to attend. The 4 most common cancers diagnosed in the UK are prostate, breast, lung and bowel. This means that breast cancer is the 2nd most commonly diagnosed cancer in the UK. What is breast cancer? Breast cancer is when abnormal cells in the breast begin to grow and divide in an uncontrolled way and eventually form a growth or a tumour. Breast cancer most commonly starts in the cells that line the milk ducts of the breast. It mainly affects women, but men can get it as well. Breast cancer risk can be affected by age, family history, and lifestyle factors. This includes obesity and smoking. Around 56,800 people are diagnosed with breast cancer every year in the UK. How is it diagnosed? You usually start by seeing your GP if you have potential breast cancer symptoms. Your GP will examine you and may refer you for tests to a specialist breast clinic. You may have had changes picked up through breast screening or the mammogram. The UK National Breast Screening Programme uses breast x-rays, known as mammograms, to find breast cancer early before it causes symptoms. Finding breast cancer early means that you have the best possible chance of being successfully treated. If you have any breast or chest changes or are worried that you may have cancer, you should speak to your GP. How is it treated? Treatment for breast cancer depends on several factors, such as where your cancer is, how big it is, whether the cancer cells have certain proteins or receptors, and your general health. A team of doctors and other professionals decide on the best treatment and care for you. Surgery is often the first treatment for breast cancer, but other treatments include radiotherapy, hormone therapy, chemotherapy, or targeted drugs. Screening rates in Leeds. So this table is looking at how many people or women are attending their breast cancer screening programme from the age of 50 to 70. The national target is 70%. As you can see from the table, in Leeds we're currently at around 62%. It's important to note from this table that we have a bit of a data lag, so we can't see in real time what the screening uptake is. This means that we're looking at data from last year, so 2024. This can make it difficult when there are initiatives running to see in real time if that initiative is successful for increasing that uptake. Primary care networks, or PCNs, in the most deprived areas of Leeds have the lowest uptake. So this is areas such as Bermontoffs, Richmond Hill and Hare Hills, or BHR, and Beeston, Middleton and Hunslet. What breast cancer can look and feel like. Here is an infographic from the Know Your Lemons campaign. Often we find with breast cancer, people just think about a hard lump, but it's any changes to your chest, okay? So it could be a new size or shape. It could be rashes or dimpling of the skin. It could be the feeling of heat. It could be liquid from your nipple, but you're not breastfeeding. It could be that your nipple started facing inward, but it was originally out. It could be a feeling of a thick area on the chest, or it could be a growing vein. Here is a quick video from Copperfield, one of the leading breast cancer awareness charities. This video is all about the importance of self-checking once a month and how to do so.
There are no rules for boob checking. Just do whatever feels comfortable. The key is getting to know what normal feels like for you. All you need are your hands, your boobs, and some handy pointers. You can check anywhere, in the shower, on the sofa, even when you're getting dressed. Just make it part of your normal routine. Everybody has breast tissue, all genders, so we should all be checking. You spend more time with your body than anyone else, so you're the best person to know how your boobs usually feel. All boobs are different, and they'll naturally change throughout your life, even each month, so get to know their natural rhythm. Note anything that changes or seems unusual. If one area feels thicker or any new lumps appear. Or if you notice a sudden change in size or shape. It's normal for boobs to hurt around your period. But if the pain is different or there more often, then get it checked out. Keep an eye out for changes to the skin like dimpling or puckering, or any unexplained rashes or redness. And don't forget your nipples. Look to see if they've become pulled in, moved position, or changed shape, or if there's any crusting or liquid coming out. Make sure you're feeling everywhere there's breast tissue, not just your boobs, but right up to your collarbone and under your armpits too, in case there's any swelling. We recommend copping a feel once a month. And if you notice anything that doesn't feel normal, monitor it for a week and book an appointment with your doctor. Sign up for our handy reminders so you remember to check.
The National Screening Programme. The National Screening Programme for breast screening is known as the mammogram X-ray. This takes 2 images of each breast, one at a time. It takes an image from the front of the breast and at the side. Women are automatically invited from ages 50 all the way up until 71. This is because breast screening works in rounds and depends on your GP practice. So, for example, you may have been 48 at the time where it was your GP practice's turn, so then you might get your letter at 51 when that round comes back again. The screening's every 3 years, and those who are over screening age can request to have an appointment. So they won't get that letter automatically after 71, but once you get to 74 and you still want to have your mammograms, you can ring the number on screen and get booked in. It's just relying on you to remember to do this every 3 years. Breast screening top tips. You will need to take off your clothes from the waist up. So if you wear a dress, be mindful that you might have to take the full dress off, or it may need to drop down to the waist. The whole appointment should take around 30 minutes. You may have your screening at the hospital, or you may have it in a mobile unit in your local area, for example in a leisure centre car park. You can talk to the mammographer, who is trained to help you feel more comfortable and give you support. So if you do have any worries or if you're not sure about something, please do speak to your mammographer. They don't know that you're possibly uncomfortable until you let them know, okay? And they want you to have a successful screen. You can stop the appointment at any time if something's uncomfortable or if you're not sure. Please feel free that you can stop that appointment. Your mammographer will always be female. Avoid the use of talcum powder or spray deodorant on the day of your mammogram, as this can affect the images. Remove any necklaces or nipple piercings before. If you are trans or non-binary, you may be invited automatically, or you may need to talk to your GP surgery to make sure that you receive that screening letter. 3 key steps to giving advice. We hope this information in this module has been useful, but we really would like people to share this information with friends, family, it might be colleagues as well. So ways to do this is 3 key steps. Ask, advise and act. So ask, raise the issue during day-to-day contact with the person, sowing that seed. Advise, give tips and messages about well-being and cancer and dispel any myths. Act, signpost people who want to know more or may need more in-depth support to local agencies which can help. Further information, please make sure you are getting your information on cancer or screening from reputable websites. Please also make sure they are the UK websites, as screening might be different in different countries. So please visit places like Cancer Research UK, Breast Cancer Now, NHS, Copperfield, Leeds Health or Macmillan. This now completes Module 3. Please make sure you complete the assessment before moving on to the next module.